Subjects. So last 2 years ago we organized a conference on COVID management in Karnataka. COVID management in Karnataka, where a number of officers and NGOs who had participated in COVID, they got together so that we have brought out a booklet on the lessons of COVID management for the future. So that booklet also we have given it to handed it over to the department, so that is available. We have IIPA has signed the MOUs with a number of 13 institutions. Today we have signed it with RV University, and RV University has made a name as the most prestigious university in Bangalore, in the private university in Bangalore, with a very deep sense of quality, with a focus on quality in education. And they have made a name for themselves, carved out a name for themselves, and they are from the top rank in the engineering sphere, and I am sure that with they will soon become a top private university in Karnataka and among the top in the country. So this conference, we have been, I was earlier chairman of Karnataka Administrative Reforms Commission. So in that report we had made a number of recommendations about. We had, as Chief Secretary also, I used to review this maternal mortality rate. I used to ask officers, health department, as to why our MMR rate, Karnataka's MMR rate. We have the largest number of medical colleges in the country. We have the largest number of doctors probably in the country per population, per 1 lakh population. We have a large network of nursing colleges, paramedical colleges, and a very good health department which has delivered a number of programs. But in spite of that, Karnataka's maternal mortality ratio is highest among all neighboring states. The recent sample registration survey, sir, 21-23 were aware of that. In Karnataka, our ratio, MMR ratio is 68 per lakh live births. Whereas all the neighboring states, nearest is Telangana, which is 58, and the other states are all in the 30s. Andhra Pradesh is 30, Kerala is 30, Tamil Nadu is 35, and Maharashtra is 36. So in fact, I used to find, when I went to Bidar, I used to say, ನಿಮ್ಮ ಎರಡು ಕಡೆ ಒಂದು ಕಡೆ ಮಹಾರಾಷ್ಟ್ರ ಇದೆ, ಅಲ್ಲೂ MMR ಕಡಿಮೆ ಇದೆ, ಇನ್ನೊಂದು ಕಡೆ ತೆಲಂಗಾಣ ಇದೆ, ಅಲ್ಲೂ MMR ಕಡಿಮೆ ಇದೆ, ನಿಮ್ಮಲ್ಲಿ ಮಾತ್ರ ಯಾಕೆ ಜಾಸ್ತಿ ಇದೆ? So I think there are a number of issues that need to be examined, because we can't say that not like Bihar or Jharkhand where there are no doctors or there is no health system. Our health infrastructure is among the best in the country, health department is among the best in the country. But MMR is one area. IMRL we have made a lot of progress, but MMR is one area where we have not made sufficient progress, and we should be in the rank, we should be close to Kerala and Tamil Nadu, if at all. But yes. So in this context we have discussed in IIPA, Ramanathan has also suggested that we should organize this conference, and based on, so we have organized this conference when Dr. Ranjani wanted to organize a program on health. I suggested we should organize it on MMR, because this is a very most serious and burning issue in Karnataka, where researchers, medical experts and the administrators should get together so that we find out some, we can draw up some recommendations for the government.
Across schools to dental health, postgraduate management education, and bachelors of engineering and masters of engineering, and in university, which is the latest of the lot, which was started 4 years ago. The university today has a strength of about 6,500 people, which has 9 schools, and it's regarded as one of the best emerging universities in India. The Outlook magazine rated it as number 1 for this year's rankings. The RV Institutions and the RV Trust is committed to the cause of education. It has touched the lives of 8 lakh people over 8 decades. And today, as we talk here today, we have more than 30,000 plus students studying from class 1 to engineering and dental sciences. We give a lot of scholarships for needy and dental children. Every year, the RV Trust gives anywhere between 10 to 15 crores for needy children from the underprivileged society. I thank once again the Karnataka chapter of IIPM for inviting me to say a few words and share my thoughts about the RV institutions.
It's a very independent school of economics. He didn't want to put economics as a department as part of School of Liberal Arts, which many other universities have. As we moved along, and Dr. Pushkarni was one of the first hires I hired way back in 2021 during COVID times. All of us joined this place with masks on in the same campus. And then it evolved to become a School of Economics. I bifurcated the school from the School of Business to give it its own shape. And then as Ranjani joined us, we amalgamated the two aspects of economics and public policy because they go along very well together. So yes, it is one of the small niche schools we have. We also have large schools like business and computer science and others, but this is one of the most important schools, and it is the most important intellectual school in our university. We've got highest number of publication from a limited number of faculty members we have, and the numbers are growing. Our students are publishing in various newspapers and journals. One student has published an award-winning book. They're also active in national and international levels in sports, so they're just not studying, but they're also doing a lot of other activities. The first debating society was set up by the first founding batch. I had only 5 students in the founding batch, and the number has now grown to almost 60. I'm very happy to tell you that all 5 students who graduated last year from our school have gone abroad to study masters in economics, masters in finance, masters in business in some of the top-rated universities, including Warwick, including London School of Economics, and one student has got a position in Institute of Foreign Trade, New Delhi itself. We are very, very active in collaboration, and one of the things we wanted our school to differentiate ourselves is to become politically agnostic and ideologically agnostic school so that we can invite everybody in to talk and debate and discuss. We are the only school which talks to Bangalore, which is the only school which talks to BASE, we are the only school which talks to ISI, we are the only school which talks to ISEC, and the only school which talks to NALSA. None of these schools talk to each other. So we invite all of them, so our school has become a kind of a interesting adda where people come and debate, discuss, deliberate and collaborate together.
One of the most important subjects I would say for the health department, because maternal mortality that number gives a very good clear indication of how the health system of that particular state or district is working. If all the systems are working well, then the maternal mortality should be down and it should be at the minimum possible level. So more robust the system, better the MMR. MMR and IMR become a key indicator. More than IMR, I think MMR becomes a very key indicator of the way the health infrastructure of a particular region is. And like our Dr. Ranjani, she while presenting, she said that how Karnataka, though compared to Indian standards, we are better off and we are doing better than other states in India. But when we compare ourselves to the south, which is comparatively in all indicators, whether it's economic, social, democratic, all these things, all indicators, we are definitely ahead of the rest of the country. And in this aspect, when we look at it, we see that Karnataka is behind. In some other aspects, we are better than the other states, but in this particular aspect, we are
combined Kerala, Tamil Nadu, Telangana, and even Andhra also. So, and Maharashtra, of course, our western region. So this is something that is definitely caught our attention too. And we've been, looking at how we can, because this is a very, very important thing, because if a person is dying due to, giving childbirth, then if it could have been prevented, then that is a failure of our system. And every life saved is such an important, it's such an important thing, because our life saved is something which has a great impact, not only in the family or the individual, and it's a very human angle to it. And how we can reduce this became a very important focal area for us. So sometime last year, when we were looking at this maternal death, so we decided to, though there is a program of auditing, but we gave it a more, serious look at it. And last year, I told my officers that to look at all the maternal deaths that have taken place last year, and what are the reasons for these deaths that have happened. So this detailed audit was done by our people, and they looked at from April 2024, April 1st, 2024 onwards, till I think when I gave this order, I think sometime in December, so maybe till December, Jan, they did an audit of all the deaths. And any other death that was being reported was also being looked into as and when it happened. Why it happened, what was the failure, was there a system failure, institution failure, or was there any other health reason, or something which is not identified properly. So we looked at it very deeply, and we came out with our own findings. And this year, in the CM's budget speech, we made it a part of a program that Karnataka aims for, to have a mission for zero preventable maternal death. It is called any maternal death that could have been prevented, we should touch zero. So wherever the gaps are, we need to fill that gap. Certain places, the doctors were not available on time. Certain places, the ANC checkups have not been done. Certain places, they have not been advised properly. So by the time they could reach the hospital, they found the hospital, but then they had to shift to another hospital. So on the way, they pass away. Certain procedural lapses, certain lack of having, some sort of, drugs which are essential but were not present. So in our system, I was looking at only the public system, not at the private system, only the public, our government facilities. So then we came out with this program. And our aim is to have, though our number is 68, it's come down according to our own figures right now, it's around 60 right now. So, and we started implementing this program. And I would like to say that since we started implementing this program, this year alone we have seen a 25% drop in maternal mortality in Karnataka. This year alone. So compared to last year's numbers, this year we have gone down and there's been a marked improvement. So we are looking at so many things. I think some of my officers will be coming later and will be giving you information. So we were looking at various things, even like yesterday. One of the things that we did was every taluka hospital and our important community health centers and district hospitals, of course. But every taluka hospital, right now we had a system of having one gynecologist, one pediatrician and one anesthetist. So they are not available 24 hours, 24/7. So when someone comes late evening, late night, nobody is there, the doctor has to be called. Sometimes the doctors live in the taluka, sometimes these doctors stay a little bit far away, and by the time they come, it's very late. So just in yesterday's cabinet, we took a decision now that all taluka hospitals and all the important community health centers will have minimum of 2 anesthetists, 2 gynecologists, 2 pediatricians and 1 radiologist.